Hello everyone and welcome to your Electronic Health Records course. Today we will be going over Chapter 3, Administrative Data. Before we get started, let's first take a look at today's learning outcomes. When you finish this chapter, you will be able to identify administrative data, explain the uses of data, explain the use of EHR data in an accountable care organization, explain the use of the Master Patient or Person Index, apply procedures to register a new patient in Prime Suite, apply procedures to schedule a patient's appointment in Prime Suite, apply procedures to edit demographic information in Prime Suite, follow the steps performed upon patient check-in, apply procedures to capture insurance information in Prime Suite, and lastly, locate and make sure of the help feature in Prime Suite. Now let's take a look at today's key terms. Starting with accountable care organization, administrative data, chief complaint, clinical documentation architecture, continuity of care document, data dictionary, default value, demographic or identifying data, health level 7, interoperability, library, medical record number, Medical Access and Chip Reauthorization Act, or MACRA, Merit-Based Incentive Payment System, or MIPS, National Provider Identifier, Quality Reporting Document Architecture, and UB04. Now let's jump right into today's lesson. In previous chapters, we discussed how important information and data are to the medical field. We talked about practice management and different softwares that keep information and data organized and safe. But now let's dig a little bit deeper and discuss administrative data as well as demographic data. Administrative data is non-clinical data found in the patient's health record, such as identifying information, insurance-related information, authorizations, and business correspondence. This type of data does not include diagnosis, prognosis, or treatment or plan of care. Now, demographic data is the subset of administrative data. It is data that identifies the patient, such as the full name, address and phone numbers, date of birth, sex, race and ethnicity, social security number, usually just the last 4 numbers, and marital status. Additional information collected from patients is employment or student status, employer name and address, next of kin and emergency contact information, and insurance information, such as policy name, number, and group number. This data is used for insurance from completion in accordance with HIPAA standards such as the CMS 1500, which issues a bill to outpatient encounters, and the UB04, which is used to bill hospital admissions and encounters. According to the core health data elements recommended by the National Center for Vital and Health Statistics, identifying information should include the following for inpatients and outpatients: the patient's full name, including any previous names, personal or unique identifier, such as the medical record or chart number, account or billing number, the date of birth, the sex and gender, the race and ethnicity, the residence or the address, the occupation and employer, and the type of encounter. The required inpatient data includes the type of encounter, admissions date, discharge date, facility identification or the unique identifier of the hospital, the type of facility, the attending physician identification, the patient's source of payment, if related to employment or accident, and the total bill charged. The required outpatient data includes the type of encounter, the date of the encounter, the facility identification, so the unique identifier of the medical office, the type of facility or place of encounter, the healthcare practitioner identification number, the provider's location and address, the patient's sources of payment, if related to employment or accident, and the total bill charges. The data elements that we just listed in the previous slide are also included in the Health Level 7 standards, which is abbreviated HL7. This allows different software packages to interface with one another and allows them to share data in a standardized way, allowing software to interact with one another. Now, before the software is ready for HL7, it has to be coded to standards for use. Many different medical offices take advantage of these coding systems, and there are many vendors for different systems, like a pharmacy, tracking records, and laboratory services. With HL7, changes of data in one system are reflected within all application systems by use of standard language. There are standards between them so they can communicate. It allows interoperability and can use a single database. HL7 has been the most widely used and most known standard in the healthcare industry. HL7 now recognizes new, more specific standards, which include Clinical Documentation Architecture, or CDA for short. This is the document markup standard that specifies the structure of clinical documents such as discharge summaries and operative reports. The CDA is an important part of meaningful use legislation and is used to prepare a continuity of care documents. This is the document exchange standard used to share patient summary information and ensures continuity of care among healthcare providers. Next, let's discuss the quality reporting document architecture. This is the data standard used for reporting quality measure data. It is an EHR compatible across different health IT systems. It is important for quality reporting and assists in sharing information between providers or facilities. Continuity of care documents are very important to the healthcare industry. They improve patient care and outcomes through information. CCD provides the ability to electronically share clinical data between caregivers, facilities, but not necessarily within the same healthcare facility. Service providers, such as EHR and PM vendors, are working together to form partnerships, and this will result in collaborative relationships. This then results in the goals of interoperability of healthcare electronic systems. Next, let's discuss the use of data in electronic file maintenance. One recurring theme you will see in the medical field is the importance of accuracy. Accuracy is essential with the use of data in electronic file maintenance. Make sure you collect the previous names to cross-reference files to ensure that no duplicates are entered. Remember, each patient should only be listed one time in the master list of patients. Data can be collected on patient registration forms at the time of care is established. Remember, this should be verified with each patient encounter. It ensures most accurate data on file and update changes information such as address, phone number, and insurance information. It's important that each data element should be consistently defined by the facility. For example, a data dictionary. This document specifies the format of each data field. It provides a detailed definition and explanation for that field. It also allows for consistency of data collection and should be very specific to prevent errors. Lastly, the inconsistent use of data dictionary definitions results in unreliable data. Now, this differs from a library, which is the listing of choices in computer software systems. The possible choices are shown in drop-down menus and include clinical templates. And lastly, it ensures that the appropriate data elements are used in each data field. Data are also used to satisfy HIPAA data requirements. It is used to file electronic health claims for reimbursement, where the CMS 1500 form is used for electronic submission of claims for outpatient encounters. The form used to submit hospital claims is the UB04. Now let's dive a little deeper into these forms. There are 5 major sections or levels on claim forms: the provider information, the subscriber and patient information, the payer information, the claim details, and services. Provider information that is included is the name, address, phone number, and national provider identifier, which is a 10-digit identifier used by CMS and must be used on insurance claims to identify the care provider. Subscriber and patient information is also included. It includes information about the policyholder and the patient, which may be the same individual. That information includes policyholders or the subscriber's name, group or insurance plan claim, identification or policy number, and the patient's relationship to the policyholder. Next, let's talk about payer information. This is another form of data that is included. It consists of a group insurance plan name, plan identification, address of the insurance company, and assignment of benefits. It also allows payments to be made directly to the provider. Also included in the payer information is the release of information authorization, which allows clinical information to be released to the insurance company. Next is the referral number, which is used when the patient is referred by another provider, and the prior authorization number, which is necessary when insurance plans require approval. Next, let's talk about claim details. They are including, but are not limited to, patient account or identification number for encounter, total charges submitted, place of service code, provider signature, details about onset of illness or accident, dates of service, amount collected from patients such as copay, coinsurance, or deductible, the unique identifier, the ICD-10-CM codes to document diagnosis, if the encounter was due to an auto or other accident, and if the encounter was due to a work-related injury. Next is services. We use CPT codes to indicate procedures performed, like the ICD-10 PCS in hospitals, and it's important that we make sure the date of service is included as well. Next, you want to list the use of data. This information is collected in the major sections of insurance claim forms and can overlap. Administrative and clinical data may be used to satisfy requirement. Administrative and clinical data may be used to satisfy reporting requirements. The CDA is used for an important piece of the meaningful use legislation and preparing a continuity of care document. Race and ethnicity, patient's preferred language, gender and date of birth, the patient's smoking status, are all pieces of information that are included. It can be filtered to extract specific reports for meaningful use requirements. Next, let's discuss the accountable care organizations. This is part of the Patient Protection and Affordable Care Act. It was included in the healthcare reform legislation passed in 2010. It is a healthcare reimbursement model in which hospitals, physicians, and other healthcare providers form partnerships. It also benefits patients because it provides a high-quality coordinated care to patients. All entities in an accountable care organization are accountable for the following: quality of care, efficiency of medical services, patient satisfaction, and patient satisfaction. With ACO, there is also a pay-for-performance model of healthcare reimbursement. This is where the payment is based on the quality measure that used. The data are necessary to report the results of the used quality measures. Other ACO models include the Centers for Medicare and Medicaid Services, as well as commercial payer models. ACO models are reliant on data gathered from providers' EHR systems and exchanged with other providers. This provides a better coordination of care and reduces incidence of redundancy or unnecessary treatment or diagnosis, which in turn decreases revenue for providers and is essential for cost containment. Health information professionals and practice managers are essential to ACO models because of what their job is. These information professionals ensure quality data, making sure that accuracy, quality measurement, and data integrity are all up to standard. The Medicare Access and Chip Reauthorization Act, or MACRA, is known as the Doc Fix Act. It ends the sustainable growth rate formula that has been used in the past to determine payments from Medicare. It provides a network that rewards care providers for increased quality of care to Medicare beneficiaries. And it also combines existing quality reporting systems into one new system, known as MIPS. Next, let's discuss the Merit-Based Incentive Program, MIPS. This new payment program is for eligible physicians and will be measured on quality, resource use, clinical practice improvement, and meaningful use of certified EHR technology. Now, let's go over the MPI, or Master Patient Index. The MPI contains identifying or administrative data on each patient. The acronym MPI is used more in hospital settings than in outpatient settings. And the objective is to create one file for all parties seen in the facility. Remember, each patient should be listed on the index only once. Medical practices may refer to the MPI as the patient list or the master patient list. Visits or encounters are recorded under their entities in the MPI. Next, let's discuss registering a new patient in Prime Suite. Patients must be registered in the practice management software prior to adding administrative and clinical information. The registration then populates in the electronic health records storing data within a computer's data. Patients are registered at the time of arrival. Some hospitals have centralized registration where it is all in one area, while to the contrast of that, some have decentralized registration where it is in different departments. Prime uses source documents to obtain information such as insurance, ID cards, driver's license, and so on to ensure accurate data entry by carefully reviewing source documents. Next, let's discuss scheduling an appointment. First, it's important that you get the reason for the visit and chief complaint. This will determine the time allotment for the appointment. Next, ask the patient for convenient days and times. Then you'll search for available appointments and then schedule the appointment. Now, people move, get married, and divorce, causing their names to change, and get new phone numbers. It's important that an office always has up-to-date information, including identifying information about patients, patient demographics, and that the office should ensure up-to-date patient information. The office should already have a system to update patient information, whether it be at the time of check-in, at each visit, or annually. It's important that edits should be made when patients communicate the changes. The office should already have a system to update patient information, whether it be at the time of check-in, at each visit, or annually. It is important that edits should be made when patients communicate changes. Now, let's discuss checking in the patient. Patients flow through the office and can be tracked with PM software. It begins when a patient checks in at the front desk. When the patient checks in, they will sign in to the log sheet and verbally inform the healthcare professional of arrival. Once the patient is checked in, they will be seen by the clinical support team, the care provider, and then once the appointment is finished, the patient will stop at the cashier or checkout desk, and then the billing process begins. While checking in the patient, there will be default values and information that autofills. Make sure you refer to the most common entries already placed in the leads. Make sure you refer to the most common entries already placed in the fields. If the information that has been autofilled is incorrect, it can be revised. Next, let's discuss capturing insurance information. Medical practices and hospitals are businesses. Make sure you don't forget that. So because of this, they must sustain viability. Organization is key for effective policies and procedures, and medical facilities must ensure cash flow and fiscal success. Your insurance information is collected for billing of procedures. One piece of information includes the ID card, which should be presented with each patient visit. The card should be scanned or copied and placed in the patient's record. It is important that when entering the insurance information that it is entered correctly as it appears on the card. Any errors may result in delayed or denied claims and will slow the payment process. Okay, and lastly, let's discuss utilizing the help feature. The help feature is the staple in any software computer programs. Users should access the help feature when needed to ensure accurate information and allow for better understanding of the program. Now, more specifically, the Prime Suite help feature helps connect users to the Prime Suite User's Manual. It includes information on getting started and navigating Prime Suite. In addition to that help, it also offers Prime Suite topics, frequently asked questions, and workflow solutions. That concludes today's lesson. If you have any questions, feel free to reach out to your instructor.